All right, guys, it is Sunday night, and that means it's Sunday night service. And I have got the one and only Dr. Dennis Goodman with us tonight, live from New York City. How are you, Dr. Goodman?
Hello, Dani. What a pleasure. What an honor to be back on your show.
It's so good to see you.
You got the best healthcare show, Facebook Live, that there is.
Well, we don't. Well, thank you. We don't really have a show, I guess. But anyway, well, I appreciate it. Guys, while you all are getting logged on, and I see people popping up right now, while you all are logging on, I need you to hit your like buttons, hit your heart buttons, share it, comment, put your questions out there. We are talking the power of vitamin K2-7 tonight. Vitamin K2. I'm excited. Dr. Dennis Goodman wrote a book, which is a fabulous book on it. Yes, I see you guys logging on. Hello, you guys from Florida and Nunnally and all kinds of places. He wrote this book, and it's an incredible book, and we're going to break it down tonight. We're going to talk about K2-7. But first, I'm going to tell you about Dr. Goodman that we have here, who's a world-famous cardiologist that we just love. I just love him so much. I'm honored that he's my friend.
My mother agrees with you, but that's it.
Well, I don't believe that. He's the director of integrative medicine at NYU, New York University. We know, my favorite university ever. I would have loved to have gone there. He's a clinical associate professor and cardiologist,
I'm actually a professor. I was an associate professor. I'm now a professor.
When did that change? Well, I got the old.
It's okay. It's okay.
Okay, so now he's a big professor, and that takes a lot of work to do that. I know all about that.
That's why I want you to mention it.
You bet. That's a big deal. Cardiologist at the Department of Cardiology and Preventative Medicine. He's board certified in everything known to man: cardiology, internal medicine, lipidology, right? Cardiac CT imaging, integrative medicine. He's also on the board. Okay, you're in Cape Town. Tell me about that, because clearly
I went to medical school at the University of Cape Town.
Okay.
And in the last few months, I got the privilege of being made an honorary professor there. And it's very exciting for me because, that's where I trained. And my plan is next year in February to go and be a visiting professor there and give back something to, the university where I trained. So I'm looking forward to that.
Oh, my goodness. That's exciting. I had no idea. Congratulations. Hey, hey there. All right. Okay. We're talking K2 tonight. Put your questions up there. Tell us where you're from, all those things. Well, as much as popular as he is, I'm honored that he's my friend. I'm thrilled he's our colleague, and we've known each other now for several years. And he's just an amazing all-around man, which you guys know that because when you watch the Magnesium Sunday night service, I had so many people tell me, "When's Dr. Goodman coming back? When's Dr. Goodman coming back?"
Thank you for the kind words,
Dan. Well, you're welcome. And
I have to say back, I think you're the rock star.
Yeah, right.
Right, yeah. You are. Look, I actually got the privilege of coming to visit you recently.
Yes.
You have the most amazing clinic over there and wonderful staff with a great atmosphere, and really, it felt like a healing center.
Well,
that's how I would describe it.
Well, that means a lot coming from you, because you've done all the big things and all. I mean, this guy's like a top doc all over the country, voted and all. I appreciate that. That we were thrilled to have you in the office, and
pleasure.
Yeah, that was fun. That was a ton of fun. That was a good conference, and I was great to have you. I was thrilled to have you there. But guys, let's get busy. We're talking about vitamin K tonight, and you take vitamin D, right? This is just my vitamin D here that I have from the office, but it's my personal one here. There was a study in 2017, right, that showed that vitamin D alone can increase your risk of heart disease, right?
You mean vitamin D deficiency?
That is correct. But
not
also
vitamin D alone. I mean vitamin D deficiency.
Yes, vitamin D can increase your risk of heart disease, right? But what if I told you, guys, that there was a vitamin out there, right, that could help with your osteoporosis? It could help pull calcium out of the arteries and lay it down on the bones, right? It could help with your diabetes. Do you know that K2 can reduce diabetes risk by 20%? This was in a Dutch population study that was over 10 years and 38,000 patients, right? It can help with cancer, possibly. There was a German study of 23,000 patients that showed that A higher K2 intake was associated with a lower likelihood of cancer. Same thing for prostate cancer risk. 35% lower risk of cancer, of prostate cancer in 11,000 patients that were studied. Also, what if I told you that there was a vitamin that, you know, could help with your neuropathy, your numbness and tingling, right? In the feet, muscle contractions, your mitochondrial health, which is very fascinating to me. It could increase your cardiac output, which we're going to talk about there, right? And it's also anti-aging. Pretty fascinating. Vitamin K2. Let me know if you guys take vitamin K27 at all. I mean, I want to learn about this vitamin. Dr. Goodman wrote the book on it, and we're going to talk about it tonight. I personally take it, but I only started taking it after I was diagnosed, Dr. Goodman, with osteopenia about 2 years ago. And I was like, what? I've taught yoga for years. I've taken yoga for years, and I have osteopenia slightly, but I have it.
Okay. Well, firstly, thanks for the great introduction. And you did a great job of mentioning, you know, all the possible benefits. But I think what we try to do, both you and I, is try to have some science behind everything that we may recommend for somebody.
That's right.
And that's very, very important. So when I wrote this book, which was a few years ago, it's because people started asking me, and as you know, I'm in integrative medicine and integrative cardiologist, and patients started saying to me, well, should I take K2? And I was like, I really don't know enough about K2. And I went to read about it, just like most people do. I don't know how many people online tonight actually know about K2, because most people, vitamin K2, don't actually know about it. That's right.
I was never taught anything about it in school, and none of my
And in Western medicine, I mean, really, most people don't know anything about it. You certainly doesn't hardly get mentioned. And I'll tell you, you know, so when I started to read about it, and I said, wow, there is enough good evidence here that it clearly, in my opinion, with the evidence that there is, has a benefit definitely in bone health, and that means osteopenia, osteoporosis, and probably in cardiovascular health. Now, when I say probably, we haven't been able to prove yet that it's going to help you prevent a heart attack. But we know that, and I'm going to tell you in a minute, the mechanism in vitamin K2, we know that it reduces calcification in arteries.
That's right.
And so what the whole point is when it comes to calcium, and this is what's really important for people to understand, if you actually say, what is the mechanism by which vitamin D is important when it comes to your bones? We know that, right? And the reason that vitamin D is so important, besides all its other things, it's got to do with immune function, it's got multiple benefits, but its major role, okay, is to increase calcium absorption in the body, okay? So we know that if you don't have enough vitamin D, if it's not made in your skin, or you're not getting enough of it, you know that it actually comes from sunshine, the skin. There's a conversion in the liver and the kidney to get to the active metabolite. But this is one of the messages that I always put across. If you are missing something, that, for example, you don't have enough vitamin D, you can take calcium and it's not going to get absorbed properly.
Right.
So it's important that these things get taken together. That's why I'm a big believer that I call it the symphony, the synergy of magnesium, vitamin D, K2, and calcium. Right. That is a combo that's very important. I'm sure you agree with me.
I do agree with it.
When you're talking about, you know, giving some benefit to people for one of these things, you need the others as well. They work together. So vitamin D, and it's vitamin D3, which people take, many people take it. So let's just stop for a second and say, well, how do you know if you're vitamin D deficient? I'm sure you've told your listeners many, many times. The good thing about vitamin D is that you can measure it.
Yes, yes.
And you get a blood level, and it's very easy, and it's called, so you imagine you can measure your vitamin D 25 hydroxy level.
That's right.
What you measure. And it's a little debatable about where your level is the best level, but I'm one of these people who say make it 45 to 55. So I don't know where you come in, because 30 is regarded as the lower. It's not good enough, in my opinion.
No, and I tell people at least 60.
Okay, so you can do that, but there've been studies, and they've studied some tribes in Africa, that do extremely well, and from a heart disease and bone health, and they've got them average around 50. But so we won't argue about it, but I say when you're 50, that's a good number. Okay. And you probably got enough vitamin D around. So that's one easy way, because people often say, well, how do I know if I'm vitamin D deficient? Well, you get your blood tested. It's very easy.
Right.
So we're not talking vitamin D tonight. I'm sure you discussed it many times, but I wanted to bring it up because it's the first step to understanding that you've got to have calcium in your body, which is really important for bone health. Calcium, very, very, it's also important for many other things, the nervous system, for, obviously in your teeth. We need calcium. It's very, very important. But its major role in the body is actually calcification in the bones, because it's very, very important that your bones calcify properly. And if you don't have enough vitamin D3, you won't get enough calcium in the first place. Now, where does vitamin K2 come in? So first, let me just tell people, we've all heard of vitamin K. Now, vitamin K, what people don't really understand, is actually part of a family that includes K1 and K2. All right, so there's vitamin K1 and there's vitamin K2. I wrote this book about vitamin K2. Right. Most people know about K1, okay, which is called phyloquinone. That's the phyloquinones as opposed to minoquinones. And K1 was discovered like around 1930, where they found out that there was a guy called Dan, and he actually discovered that there was something inside the chickens that stopped them that stopped them from bleeding to death. It was so what it was is a coagulation factor. And we know that vitamin K1 is important for production of clotting factors.
Correct.
2, 7, 9, and 10. Okay, and it's a fat-soluble vitamin, so you need fat around to absorb it. 2, 7, 9, and 10. So I want to first distinguish vitamin K1, which is when people talk vitamin K, most people are thinking about K1. Where do we find K1? We find it in green leafy vegetables.
Right.
Okay. We need K1 primarily for clotting factors.
Okay.
So we want to separate that now from another part of the family, which is the K2 part of the family. Okay. And K2 is then divided up into, like, you could think of it as the brother with now the children. It's MN. When you said K2, it's MN4. So it's minoquinone 4, 5, 6, 7. It actually goes 8, 9, and 10. But the one that's probably most important is the MN7. That's why you mentioned 7. And it's the K2 that's really, really important. That has MN7 in it, and I'll tell you why. We think that the MN7 is the one that's got a longer half-life, and that's really important in terms of getting into bones.
Right.
So this is the key thing. I told you what the action of vitamin D is, but the action of vitamin K2 is to actually carboxylate osteocalcin. So osteocalcin is made in the bone by something called osteoblasts. Osteoblasts are the builders of bone.
That's right. They build bone.
You need osteocalcin because osteocalcin is what takes the calcium and binds it into the bone. If it's not activated, then the calcium doesn't stay in the bone. So just in terms of mechanism, what happens is vitamin K2 carboxylates osteocalcin, and that's why the calcium stays in the bone. All right?
Okay.
So that's what its role is when it comes to bone. We'll talk about some studies in a minute. The other effect it has is that it works on something called matrix GLA protein. So matrix GLA protein is important because if that's activated, okay, what it does is it inhibits calcification in arteries. Okay. Matrix GLA protein takes calcium and takes it out of the blood and sends it off to the bone.
Right.
So you need these. This is the mechanisms. These are the two key words: osteocalcin and matrix GLA protein. So if there's anything that's important for you to know, it's that vitamin K2, its major role is to direct the calcium to the bones and keep it out of the arteries. So let me give you an analogy. If you go to a play or you go to the theater and you've got tickets, okay, you don't know where to sit. So what happens, there's an usher standing there with his little, her or his flashlight.
Yes.
They take you to your seat. So that is what vitamin K2 does. It takes the calcium to its rightful position. So you can have calcium around, but if you don't have the usher, if you don't have K2 saying, listen, through the mechanisms I just told you, calcium lands up where it's supposed to go.
Okay.
So now, if you are K2 deficient,
right,
you can imagine from what I've just told you that you've got increased risk of having first osteopenia, which is just means there's a, we've got definitions of osteopenia and then osteoporosis. Osteopenia comes before, which is just before you get osteoporosis, where by definition, you've got a reduction in bone mass. And
that's right. Now you're stressing me out. I'm going to take my K2 today. I love this. So.
What I can tell you is that I really believe that
it works better if you drink it with rosé.
I really believe that K2, from all the studies I've looked at, is very important for women and men, but particularly women, for reducing your risk of osteoporosis.
Yes.
So, and I can tell you one of the places where we found out a lot of information is Japan. And the reason is, and this is another key thing that I'm going to tell your audience tonight, where is vitamin K2 found? That's what people are asking right now. I told you vitamin K1 is green leafy vegetables.
Yes.
But K2, it's very hard to get K2 in the diet.
That's right.
There's just not enough of it in the diet. It actually comes from fat, from certain meats, fats, cheeses, certain cheeses, sauerkraut. But its major efficacy, or where it's majorly found, is in natto.
Yes.
So you know what natto is, Dani. So Dani, natto is fermented soy.
Right.
And they like that in Japan. They have a lot of fermented soy. And they found out that in Eastern Japan, where they eat 3 to 4 servings of fermented soy a week, they had a lower incidence of osteoporosis and hip fractures.
Yeah.
And that was the beginning of finding out, wow, what was going on. And since then, there've been studies where they've actually given people, they've given them vitamin K2. What's the dose, just so that we get onto this? It's 180 micrograms per day.
Right.
Okay. You can take between 180 and 360, but in the studies I've seen, at least 180 micrograms of vitamin K2 a day is what you should take. Now,
mine's 320.
Okay, so that's good. So I've seen between 180 and 360, 320. There's nothing wrong with that. It's absolutely fine. You're covering the bases.
Thank you.
What's important to know is that if you can get natto, that's another way to take it. And in fact, when it comes to a lot of the studies, they've shown, and these are kind of epidemiological observational studies, that in populations where they eat a lot of K2 through natto predominantly, but they have a diet high in K2, you see very positive studies coming through.
You sure do.
So I think what we should just be honest about is, if you don't mind K2 in the form of natto, you can get it. And it is something that you can actually get at Japanese stores. There's someone, I've actually got a friend called Anne Yonatani. I am going to just mention her name because she makes natto. She's a microbiologist here in New York, and she actually puts the soy, ferments it with these bacteria subtilis, which is what you need, the combination. So she actually has a product called NY Natto, which is New York Natto. She sends it to you, she makes it, and if you take 2 teaspoons of this, you've got enough natto every day. So that's what she does. I'm just telling you that there is another one. There's a California natto. There are other brands out there, but I happen to know that she makes a good brand. So
a good one. It's an organic one. So
yes, totally. And
I've never eaten it. I don't even know what it tastes like.
I know. So I've actually, I met her and she brought it to me, and we ate it on little crisps, on little wafers, and I had no problem with it. But you can mix it in with a cereal. You can mix it in with lots of different things.
Is it runny or is it
slimy? It's kind of a slimy thing.
That's what I had read. And some people eat it with raw eggs, and I don't know.
You know, so what I'm saying to you, and the other advantage of the natto, if you take it like that, it's got a lot of good bacteria in it. So it acts as a really good probiotic.
Okay.
And
New York natto. Okay.
That happens to be one. And I'm just saying you can, but that is a place, if you go to that website, she's very, very knowledgeable. She knows a lot about K2.
Okay.
And she's a good resource.
Okay.
If you don't want to take the natto, then you can get the supplements, right? And we've just, and I'm going to just tell you that there are a lot of reputable companies that make K2, but you want the MN7, okay? You want the, and that's important. So I'm going to leave it to you. When I do this kind of thing, I don't like to sit there, even though I mentioned her because of natto. When it comes to supplements, you can tell your audience who you like to use. You want to go with a reputable company, and there's several out there.
Well, that's true. I happen to use Microbiome Labs one, you know, megaquinone, and it is all the things that you need. It's you know, K27, M7. It's all of that. It actually has 30 milligrams of zinc in it as well, and a tiny 400 milligrams of magnesium in it.
So you see, it's interesting. You found product exactly what I'm talking about. They put together this combination, so you don't have to be saying to yourself, "Oh, I must take my magnesium, now my vitamin D." They put it together, which I always said is a brilliant idea. Yeah, and it's got K1 in it as well, 200 micrograms. I think they do a really good job. I like Karen's stuff, and that's the one that I use in the office, but there are other ones out there. Absolutely. And I completely know that. There are a lot of good companies.
I'm looking forward to having my DEXA scan done again and see if, you know, my numbers have changed at all. Okay.
Well, one of the things that you may find out, at least you can inhibit the progression of osteoporosis.
Yes.
It's very, very important to see that it hasn't got worse.
That's right.
So I am a big believer, if you've got osteopenia, you know, and you find that out, or osteoporosis, but, you know, imagine osteoporosis you're already further down the line. But if you know you're going down the road of osteopenia and you've got osteopenia, you should take K2D3 right away, and calcium and magnesium. So I want to make that clear. So when it comes to bone health, I believe that vitamin K2 has enough evidence behind it to take it. Now, I have at times asked my rheumatology colleagues about it, and some of them say, "I've never heard of it," or
I know.
"I don't think there's enough evidence." So I am not poo-pooing that. I'm just telling you, despite the studies that come out, it hasn't really hit prime time in Western medicine.
You're right. Well, that's the story of our life. And
that is a story, and I'm a big believer, as an integrative person like you, we need to just take the best from both sides, and we need to listen to each other and educate each other. It doesn't do any good to say, well, they don't know what they're talking about. We have to say, listen, and I've done this many, many times in my own world at NYU, of educating other doctors about supplements like magnesium, where there's really good evidence, and I feel very comfortable. When it comes to K2, I feel very comfortable when it comes to bone health.
Yes. And well, it's the first line of treatment, I think, in Japan for osteo.
Yes, they've got it. They actually, exactly, first line of treatment, whereas here we use, you know, the biphosphonates. And also they put it in, you know, they put it in products over there. There's an actual recommendation that you get, I think it's 90 micrograms every day. In Japan. So and in Europe, they're taking it on board. So it's going to take a while before that is a recommendation here in the United States. But that's why you do your show, because you know that we've got information already that we feel good enough to make a recommendation. Now, when it comes to cardiovascular.
Yes, that's what I was just getting ready to ask you. Speak a little bit, and I apologize. Harlan is snoring over there. You saw my dog. Are you hearing that?
As long as it's your dog.
Okay. It's not me or anybody in here. Harlan.
He doesn't have, as long as have you checked him for sleep apnea?
Well, yeah, he's so old now. I feel certain he has sleep apnea. Yeah, everybody.
I'm glad he's at home with us.
I know. But cardiovascular wise, coming from here as a cardiologist.
Yeah. So the cardiovascular story is it sounds like a good idea to have less calcium. I mean, we know when an artery calcifies, it's part of the atherosclerotic process.
Right.
So you want less calcium in your arteries as much as possible.
Yes.
And we know from something called a calcium scan, which is a CT scan of the heart, of the coronary arteries, that when you have a calcium score of 0,
yes,
your prognosis is very good.
That's my score. My score was 0 last year.
But that means you've got a risk of something like 0.5% over the next 5 years. It's very good prognostically at predicting whether or not you've got a risk for cardiovascular disease.
That's good, because everybody in my family falls over dead of sudden cardiac death.
So it's a very good way.
My grandfather, both grandfather. Well, yeah. Did you know my one grandfather? He was the 13th person in the United States to have open heart surgery.
Wow. Yeah, I think
they all have heart disease.
I think we need to come back one day and talk about lipids and talk about how you manage that, because I use calcium scanning a lot to try to determine whether someone's sitting with, asymptomatic cardiovascular disease.
Well, we need to do that. Let's do that one night, because actually people just popped up their heart buttons whenever you said that. So we definitely should do that. And I don't know the scoring on that. I mean, I have a 0. I had a patient though the other day with a 40.
Yeah. So the thing is, what they do when they get the score, they'll tell you what the score should be for that age group and where you fall in terms of percentage. So what'll happen is you'll get a score and it says you're above the 75th percentile, or you're below the 25th percentile, you're in the 50th percentile. The fact is, if you're in the 50th percentile, it's not like a good thing, because basically atherosclerosis is quite prevalent in the community. So you'd rather have no score. But if you've got, the lower your score, the better for prognostic purposes. Now, let me tell you an interesting thing. It turns out statins, medications, actually deplete, as you know, the body of CoQ10, but also vitamin K2.
Oh.
I don't know if you knew that.
No.
So
if you're on a statin drug, it depletes your K2.
It does. And it's interesting, in 2 years ago, in 2016, there was an article in the New England Journal of Medicine showing that in patients on moderate and high dose statins, there's increased calcification in their arteries. In other words, their calcium scores are higher. So that created a lot of consternation, you can imagine, because people were like, well, if I'm taking a statin, why is there more calcium? And we know, I'm talking now, from a Western medicine standpoint, we know that there's certain people who should be on a statin. For secondary prevention, it's very clear in my mind you should be on a statin. But when we saw this increased calcification, we were like, well, what does that mean? Is it good or bad? And it came out that a lot of people weighed in and said, well, maybe it's a good thing, because when an artery's got calcium, it's not going to you're not going to get plaque rupture and have heart attacks. Do you understand that? It's sort of having cement against the wall of the artery, so that it's not going to suddenly rupture. Because what actually causes heart attacks and sudden deaths is not actually the calcification of an artery. By the time it's calcified, it actually, the walls, is calcified. You don't get plaque rupture there. What happens when you get a calcified artery is it tends to narrow the artery. So those patients with a lot of calcium will present with a blocked artery, and they usually have an angina, chest pain or shortness of breath, or they'll have an abnormal stress test. But plaque rupture occurs when you've got soft plaque. Okay, that ruptures through the wall. Do you know what I'm talking? Do you know what I mean, one day I'm going to be.
But I just wonder if the people know the difference between plaque and calcium. But I didn't realize that plaque was soft. I knew calcium was hard.
Atherosclerosis starts off where you get LDL cholesterol, oxidized LDL gets through the wall of the artery, and it is perceived by the body as something foreign. And that's why the macrophages come in, and they're basically trying to get rid of this oxidized LDL. They encircle it, they engulf it, and you're left with a little fatty, think of it like a little fatty deposit, like cheese. And it sits there in the artery, and it starts to swell up the wall of the artery and impinge on it. And then the body, that once that this fatty deposit, it can then calcify. Because the body is trying to protect. What's happening is naturally the body's trying to protect itself from this fatty deposit rupturing through the wall, because when the fatty deposit touches red blood cells, in other words, your blood, it clots. Yes. And that's what blocks the artery. Anyway, this is a little technical, but I'm trying to explain to you calcification of an artery, okay? We don't want calcification of arteries in general because it's prognostically not a good thing. But when you're on a statin, because vitamin K2 is depleted, I put patients on statins, on K2 and CoQ10 myself. And having said that, I will tell you, we don't have good evidence. We don't have big studies. Even the CoQ10 studies that have been done, a lot of them they've basically been negative. And that's why it's never been taken on board. You've got to understand, it's not something that's recommended out there, by American Heart Association, American College of Cardiology. But I know in my own practice that I've had patients with muscle aches who I give them CoQ10 and they do respond and they do feel better. I'm sure you've had the same. Is it placebo? We don't really know. But I want to just be out there and be clear, because you can't stand there and aggressively say, well, we've got very good evidence that when you put someone on CoQ10, they're not going to have muscle aches. The studies haven't borne that out. But what we do know, which is a fact, vitamin K2 and CoQ10 are depleted with statins. All right, so that's one group of patients. I was trying to tell you where I would use K2.
Okay. Also, when I was reading in your book today, the Rotterdam study, right, which was like over almost 5,000 people, not quite, men and women,
4,800,
over 10 years. That study was showing just that 45 micrograms of K2 showed a 50% reduction in arterial calcification.
And that study,
did I read that right?
Yeah, many years ago, they showed a 50% reduction in heart attacks.
Yes, 50% reduction in cardiovascular death.
And 25% reduction in mortality.
Well, you already.
I'm glad you're reading your book. But
you didn't have to read it. Already
years ago. Now remember, Dani, that wasn't a supplement. That was people who were getting it through the diet.
Through the diet.
The people who had the highest amounts in their diet, and at least 45 micrograms, had a significant reduction in events. And that's why I'm telling you that I am a believer that maybe when you get it through the diet, it may be better. Because what we've done is there have been many studies now trying to show that if you take K2, you can reduce calcification in arteries. I mean, calcium scans, and there were studies in diabetics. It hasn't come out. Look, it's one of those things that right now is disappointing. We can't prove that when you give K2 as a supplement, you're going to reduce calcification in arteries. We want to believe it because that makes sense.
Right.
But studies are still being done. I'd like to be able to say to people, look, when I see a calcium score that's abnormal, which I want to put you on K2, which I do, by the way, because I just believe, why not? But we haven't proven that those people, by doing that, are going to have less heart attacks. Do you know what I'm saying? We haven't got the...
We haven't proven that, but we have proven that it is very safe.
We have, and we've definitely got studies that show in people from a dietary perspective.
Yes.
We have lesser cardiovascular events in people who have enough K2 in their diet. I mean, there was a study, it's many, many years ago, it happens to be a mouse study. They found that people who have, this MGP, this matrix GLA protein that I spoke about, the mice who landed up, who had the matrix GLA protein that was not active. I told you that it inhibits calcification. They died of heart attacks and diffuse atherosclerosis and calcification. And that was the first clue that you need matrix GLA protein to keep the calcium out of the arteries. But I like to always leave people with recommendations. So I think I've been clear. When it comes to osteoporosis, I think that I would give it to everybody, okay? And when I say everybody, certainly women, and taking vitamin D, magnesium, and vitamin K2. Why not? Especially if you've got a family history or if you've got osteopenia. And many people say give it to even the kids, because you know that our bone health is that, you saw it in my book,
I read it in the book.
You've got optimal bone health in your early 30s.
In your, that's right.
So you want to have this K2 in your system in your 20s and teens while you're building up your bones. So that's.
So feed them natto for breakfast instead of
exactly, and
that's Hot Pockets and toaster strudels and drive-in Chick-fil-A, right?
Exactly.
I can see a kid getting some natto. But Kate asked, can starting K2 stop or help stop any beginning progression of osteoporosis? Yes, actually, we stopped it. We talked about that. It can. I don't necessarily know stop it,
but it inhibits it. It inhibits progression, and the studies have shown that you've got, when you take it, bone density is better, and you reduce the risk of fractures, osteoporotic fractures. And there's several studies. So the answer is yes when it comes to that, and I feel comfortable making that recommendation. Now, when you spoke about all the other things that K2 does, by the way, we should just make it clear that if you're on Coumadin, okay, you know that when you're on Coumadin, which is warfarin, which is an anticoagulant, we tell people you have to be careful, right? Because you don't want to eat too many green leafy vegetables because it's got K1 in it that antagonizes the effect of Coumadin, because that's what Coumadin is, a vitamin K1 antagonist. But I believe that what happens is when you take Coumadin, you actually deplete, firstly, you antagonize K1 and you also deplete K2. And they've shown people on Coumadin have increased calcification. Especially renal failure patients. So they land up having increased cardiovascular disease. So the question is, can you give K2 when you're on Coumadin? And in this country, we can't really say it's a safe thing to do because there's this real fear that if K2 also has some anticoagulant effect, then you could land up where people land up bleeding, okay? And they're going to say, well, what happened? You gave K1. It's not so much bleeding, it's actually thrombosis because you're antagonizing the effect of the warfarin. So in Europe, they feel the studies have shown that you could take 45 micrograms of K2, you'll be fine. But you should know that there are other agents that we have today called NOACs, novel anticoagulants, that are called factor 10 inhibitors. So there's things like Pradaxa and rivaroxaban and Eliquis. You can take K2, in my opinion, when you're on those products. But when you're on Coumadin, and you should not be taking K2, and any of these things that you're on anticoagulants, you discuss it with your doctor because it's very important, always. And absolutely discuss it with your doctor. When it comes to anticoagulation and K1 and K2, that decision has to be made with the doctor. But at least you're aware of the fact that K2, and that's really my message tonight, has definite benefits for women and men, but I think particularly women who are at risk from osteoporosis. And when it comes to cardiovascular disease, I told you the group of patients that I use it. The one is on statins, and the others, if I see someone who's got calcification on a calcium scan and they've got risk factors, and I say to them, you know what? Look, I think that you're probably going to be on a statin now because you've got cardiovascular, you've got calcium, and I'm going to give you K2 as well. So I use it, and I can tell you we don't have good data yet, but because of its mechanism of inhibiting calcification in arteries.
Yes.
And by the way, they've shown calcification in the aorta is reduced.
Yes.
The studies looking at the aortic valve calcification. I'm a believer that it should be used. When it comes to diabetes and cancer, we just don't have enough evidence for me to tell people it's good enough for me to say all men should take it. But there is stuff coming out.
That's right.
Like you mentioned. So what I say to people, stay tuned, have an open mind. But we can't make a claim based on what's come out yet that it definitely reduces the risk of cancer. It's certainly been shown to improve insulin resistance.
Yes.
And reduce the risk of diabetes. You mentioned one study. So do we have any other questions? I hope that's been helpful.
Well, Chris wanted to know the name of the book, and there's the book right there, K2, simple as that, K2. And there's a part in this book on like page 56 or something where Dr. Goodman says, if your health, well, he says doctor, but I call a healthcare practitioner because I'm a nurse practitioner. I'm not a doctor.
Of course, you're a healthcare provider.
So you can always ask your nurse, by the way, your nurse practitioner. But he says if your doctor's not listening to you, if your doctor's basically not working for you, then find a new one. Find a new doctor. Find a doctor that will listen. Page 64. That's where
I know you're going to quote me. Okay, that's good. That could be a tweet tomorrow somewhere by saying that. What I'm saying is,
I tell my patients that every day. Look, I work for you. I work for you. If you don't like what I'm doing, then find another provider. If your healthcare provider says, oh, there's no evidence, that's just poo-poo. That's just witchcraft or whatever. And it could be anything. Talking to you about anything. Won't talk to you about your diet or your lifestyle. You can take all the vitamin K2 in the world.
Exactly.
If you're not eating well, sleeping well, moving well, pooping well, decreasing the stress load in your life.
It's multifactorial.
What?
You know, so just to amplify what you're saying, what I'm saying is when you speak to your doctor and whatever you bring up, you want to go to someone that says, okay, maybe I don't know about it, but I'm interested in it. Let me try to read about it. Let me try to learn. And so when someone negates it off the bat and says it's, and they just say it's a waste of time, it's expensive urine, then I say, you know what, if you don't feel good about that, then consider speaking to somebody that's got a more open mind. And at least at first, always try to have the conversation with your doctor and try to educate him or her so that, and a lot of times it happens, Dani, maybe after the show, somebody takes the book. They read the book. By the way, it's called the new vitamin K2, the missing nutrient for heart and bone health. Maybe you read it. And there's lots of information in there. As you saw, I put a lot of studies in there.
Yes.
And so somebody who's got an open mind may say, well, you know what? This doesn't hurt. There's no major side effects. The only real concern is people on an anticoagulant like warfarin. So you know what? There's enough data, certainly when you take NATO, that you should take it. And why wouldn't you want to try to protect your bone health? It's such an important thing. I don't have to tell you how many people, how many people are having fractures every year. And it turns out that, people over 75 with a bone fracture, a hip fracture, they land up with 25% of them die within the next year.
That's exactly right. Worldwide, osteoporosis causes over 8.9 million fractures a year. That's a fracture every 3 seconds. Right. There's over 200 million women worldwide as of 2007. Imagine now, this is 2019, who have osteoporosis. Is that not unbelievable?
It's unbelievable. So I'm glad you read my book.
Well, I read it from cover to cover. It was a fabulous book,
to read because you can read it on the airplane and you can read it before you go to bed. It's a 2-hour read.
That's exactly right. So I read it. It's a great book. I've written in it, all of that. I'm just really thrilled. And Dr. Goodman, do you have anything? Let's see. What are you drinking? Oh, I missed what you said. Oh, this is just rosé. There was teeny tiny little bit left. This has nothing to do with K27 from our Hashimoto's party on Friday night. So it's 2-day-old rosé, and there was just a little bit, and I thought I might as well drink it, but I don't know. I took it with I drink it with my K27.
So are you taking one of those every day with magnesium and D3? And
there's my magnesium right there. Actually, I use magnesium 3 and 8, but remember this has 400 milligrams of magnesium in here. So honestly,
that's perfect.
Extra, but I do take a D3 every day, and there's a little bit of K in my D3, only 90 micrograms, it's K27 in my D3.
That's good.
Yeah. So,
and we were just talking, about companies, and it's very important. And I want to say this: you don't just go to the local vitamin store and just pick anything off the shelf, because unfortunately, we found now that some of them don't contain what it says, and it's really important. So there are big companies, Designs for Health, Metagenics, Orthomolecular, Life Extension, the one you mentioned. I want people to realize, NATO Pharma, there are very good nutraceutical companies that actually will have in their product what they say they've got in it. You do not want to pay for something that doesn't have what it says in it, and in fact could be just full of fillers.
That's just exactly what
it doesn't mean it's better, or it doesn't mean that you're going to be saving money. So
Metagenics shut down 10,000 stores 3 years ago on Amazon that were selling fake Metagenics products. I mean, fake ones. That was not even what was in it. It had the label on it. The FDA just a couple months ago came in took a whole bunch of stuff off of Amazon and CVS and Target that did not have St. John.
The Attorney General in New York came and they found five stores where they were having products that were taken off the shelf because they did not contain what they said was on the bottle. And that's one of the big criticisms, unregulated.
Yes.
And you've got to go and speak to somebody who says, you know what, I can vouch for this company. And we know that I don't do it, but there are people and you do this and no problem. But you're selling products that you know are the real deal.
That's right. Well, who've done the research. But this is what I tell my girls in the office, Dr. Goodman. And guys, I'm speaking to you all as well. I tell my girls every day, we have to practice, all of us do, whether we sell supplements or not. We have to practice with such integrity in our office with our patients, because our patients who come to see us oftentimes are desperate. This is their last hope, and they are desperate, and literally they are buying the Kool-Aid. Anything that I've said,
whatever you say, they'll take it.
That's right. And you have got to have integrity. You have to know what you're talking about, and you have to know that this is not about the money at all. This is about getting people to feel better. And I get so angry when I see people come in with literally boxes and boxes full of supplements that people have sold them, because number one, you can't out supplement a bad diet or a stressful life or things like that. I mean, stress will kill you. You know this, right? As a cardiologist,
you can out eat and out stress any of these products, whether it's pills, supplements. It goes in conjunction with a healthy lifestyle.
You bet.
Very, very important. And you discuss this all the time.
I do.
Nutrition, exercise, flexibility, stress management, sleep, and pooping.
That's right. And community. You got to have
100%.
Right.
Community, very, very important. There's many studies now that have shown, they did studies in octogenarians, and they found out that the people that are healthier at that age, and the fact that they're alive, what do they have in common? They've got community. They've got somebody they want to live for. They've got grandchildren. They've got friends. They meet people. They do things. So connection with other people is one of the most important things you can do for your health.
You bet it is. And I'm a big cultivator. I am a fan of cultivating friendships and relationships. But Dr. Goodman, thank you so much for giving us.
Always a pleasure. And congratulations on the great job that you do educating people. Because you know something, Dani, that's what it's all about. Because knowledge is power. You
bet it is. Knowledge is power. And thank you. And I appreciate you saying that. That means a lot. But guys, the next Sunday night, there's not going to be any Sunday night service, actually, for the next 2 weeks, because I'll be in Kentucky, and then it's Thanksgiving. So we're not going to do that. And then the next one will be on fatty liver disease. So
okay, good. And then one day when I get back from South Africa, we'll do something about lipids.
Oh, yeah, I'm going to hold you to that.
What are the natural alternatives? When should you use a statin? What's the role of calcium scan and carotid IMT and stuff like that?
Okay.
I want to congratulate your listeners for taking time to come and get educated. I think
They do. They show up to our support group on Friday nights for Hashimoto's. They show up here and they listen, and then they watch it later. I had a lady tell me Saturday she cleans house and she listens to our Sunday night service. She said, then I'll go back and listen if I miss something. So we've got a good tribe. We really do. Small but mighty. And so anyway, I appreciate it. I am teaching guys a class this Friday night. I'm teaching Friday afternoon at 1:30. I'm teaching the very last 6 steps to healing class at the office for the year, the last one for the year. And I'm going to teach it. Normally, Allie teaches it. You have to sign up online, though, at DaniWilliamson.com. Sign up for that. Saturday, I'm teaching the CBD class on the endocannabinoid system. And some lucky person is going to win, not this one, but they're going to win an $89 bottle of CBD from that class. That class is $10, but that's the only big class that we charge for. But that is Saturday from 12 to 1. I'm going to be teaching that, and Earth's Glory's giving away a free bottle. So that's it. We got a busy week this week. Dr. Goodman, thank you.
Pleasure, Dani. Always a pleasure.
You're leaving?
And keep up the good work and stay well and healthy.
Okay, don't log off yet. I'm going to end this, okay?
Okay.
Have a good night. We'll see you later. Get your K2. Go to New York, NATO. NYNATTO.
NY Natto, NATTO. There's a place that you can get natto sent to you. I mean, it's about $10 the bottle. This is not a lot of money. And you take a teaspoon or two in the morning. And if you can tolerate that, you're probably getting the best way that you should get your K2.
Okay, let's all order it. She's going to freak out, and put in the notes when you order it. Dr. Goodman sent me. Oh yeah, she's going to be up all week.
By the way, I don't get anything for that. Just in full disclosure.
That's all right.
I am not getting any remuneration. I just like the idea that I can refer people to people that I trust.
You bet.
And they're going to get the real deal.
You bet. Well, I'm going to check her out. Does she have a store at all in New York?
Yeah, no. So look up NY and look it up. Just Google NY Natto, and you'll
get some education on it, people. All right, guys. Appreciate it. We ran over. Don't go anywhere. I'm going to talk to you after this. All right, guys. Appreciate you. Okay.